I was like, why is it getting worse?
All I kept saying is, God fixed her, God fixed her.
Immediately, her heart started to drop. So she stopped breathing. So her oxygen level started to drop. Like her oxygen level was dropping, her heart rate was dropping. And I can remember like both of us were just quiet, just looking at them.
A child out there who has, a heart condition, VSD, we, especially in like the African region, Nigeria, we are looking to support this child's surgery. Thank you, Lord, for choosing us to go on this journey with you, to be able to share our story and our testimony to other people so that they would know that you are real. Hi guys, welcome back to Tales of the Aquarius. My name is Tammy and this is
Emmanuel?
And on today's video, we will be talking about life after open heart surgery. For those of you who are returning subscribers, you already know from our previous video that we talked about our daughter's health and the fact that she would be undergoing a heart surgery. So yes, so it's been about 2 months since then, and of course a lot has happened, and we want to touch upon the events that happened before, during, and after the surgery, and of course share our testimony with you guys like we said we will. So do you want to start?
So this, in the last video, where did we stop? They called us to, or they gave us an appointment for the surgery.
Yeah, well, they told us to go home and pack our bags, that we're going to go back to the hospital for the surgery. Yeah,
But we didn't have a date at the time.
yes, we didn't have a date. I'm not sure if we talked about it in the other video that another baby was born with a severe heart condition, and that baby needed to have a surgery on that particular day, so they gave the baby the slot and then we had to wait. And of course we were then called and given an appointment for the surgery. I think pretty much few days before,
Yeah.
like 2 or 3 days before. I think it was like on a Friday.
It was supposed to be on a Thursday.
Yeah, no, they called us on a Friday to tell us that the surgery
It would happen on Tuesday.
would be on a Tuesday. So like very few days before the surgery. Yeah.
So first on Monday we had to go to the hospital for the prep.
So for documentary purposes, this is the day before the surgery. It is past 7. We have an appointment for 7:30 where they would do all the blood work and check her weight and match her with donor blood in case they need blood transfusion, and check that she's in good health and can take the surgery, or at least she can be prepared for the surgery. And then we'll come back home and we'll go back tomorrow at surgery is at 6 a.m. so obviously we'll be there before 6 a.m. So yeah, I just wanted to put this emotion, put this feeling down. I'm at peace with the situation. I am not scared. That would be a lie, but I'm not giving in to fear, and I just know that God will do what he knows how to do best, right? So I'm okay. I'm calm. My baby is sleeping. She's had a really good night. She slept pretty much almost throughout the night, so she's chilled. I'm sure she's gonna get angry when she realizes that we have to wake her up for this, but it's gonna be over soon.
And what else did they do?
They did some blood work tests to check, if she was okay, if she was fit. They also checked her weight. They also gave me some things that was going to use to prep her for the morning of the surgery. Like she wasn't supposed to take a shower or use cream or any drink. So they gave me like I would call it disinfectant, but non-alcoholic disinfectant that we were supposed to use to clean her that Monday night and then early Tuesday morning before bringing her for the surgery.
Yeah. So they did all of these the day before, which was on Monday, the 12th, right?
Mm-hmm, yeah.
Of August. And then we were supposed to come the next day, which is a Tuesday, for the heart surgery. And we're supposed to be at the hospital at 7 a.m., right? 7 a.m. prompt.
Was it 7 a.m. or 6 a.m.? It was 6 a.m.
Sorry, 6 a.m.
6
Yeah,
a.m.
we're
The
supposed to
surgery
be
was for 7, but we
7.
had to be there 6 a.m.
Yeah. So we got dressed. We got to the hospital. We waited. We even have a clip,
Yeah.
right, of just when we got to the hospital waiting.
So it is the morning of the surgery. Okay, let me try to increase my voice. It's the morning of the surgery. We are supposed to check in at 6 a.m. Surgery is at 7. This is about 12 minutes to 6. So we're just we're just sitting and waiting for the door to be open. It opens at 6, and then we can go into the ward, drop her stuff, and they will get her ready. I'm nervous, babe. How are you feeling? He keeps saying he's fine. He keeps saying he's confident, and that's good, because I need one of us to be like really, 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 confident. I'm confident. I am at peace, but I'm also really nervous.
And then afterwards, they actually ended up putting the catheter on that day, so on the Tuesday. And so they went there, they put the catheter, they put, how many? They put one. Right?
Yeah, it was only one on
they
that
put just
day.
one at that time.
At that time, yeah.
But later on, you would find that she had multiple. But yeah, so they put in the catheter. Then the next thing was just prepping her, dressing her up for surgery, and we had we just had the duration of that spot to the operating room.
Yeah.
To basically bond. And I remember how it felt when like they were just pushing the bed, and then we got to the point where we couldn't go any further, and man, it was not a very nice feeling. Do you want to share? Do you remember how you felt?
Yeah, I do. And to be honest, thinking about it now, I actually I'm getting emotional. So apparently they have baby what's it called? Baby hospital gowns. I didn't know they had baby hospital gowns, but they had baby hospital gowns, and they brought it to me or to us to change her and take her clothes, wear her the hospital gown, which we did. And so that was basically after putting the catheter, and then they said I could take her on my arm while they pushed the bed. She wasn't on the bed, I was carrying her, and basically just walked towards the theater. I think this was like 7 a.m. exactly. Mm-hmm. And then we walked with her, and we got there the entrance, and that was the first time you were meeting the surgeon, because I had gone the day before to do all this prep, and he had to go to the office. So I got to speak with the surgeon, I got to speak with the anesthesiologist, basically like all of the heads, and I signed some papers. You didn't, because you weren't there. So immediately we got there, the anesthesiologist had to first bring the document for him to sign, because it's paperwork, it's Germany, you have to give your consent that you understand what is about to go on and all that stuff. So the father of course also had to sign, so you signed that, and then the surgeon, who's also like the head, came and said he was going to see us after the surgery. I think he shook our hands or something, I don't remember, or your hands, and he said he was going to call us. So he said, go get a coffee or something and whatever.
Don't expect a call before noon.
Yeah, don't expect a call before noon. This was 7 a.m.
This is at 7.
And then he left. So the anesthesiologist then came, you signed the document, and I was basically holding her in my arms, and the anesthesiologist then said, do you have any final words, like any final thing that you would want to do? And I don't know, it's not like it was a bad thing to say, but it just felt very real, like they're about to take my child away from me. And whatever I say or whatever I do with her in this very last moment is serious. That was just how I felt. And I kissed her and I gave her to you to kiss her, told her that I love her and we're going to see her soon. But honestly, it was the most heartbreaking moment for me because, like, I don't know if maybe you've Googled open heart surgery, but basically, like, somebody else would touch my child's heart and
stop it.
And stop that heart. Like, that heart is going to stop for a couple of minutes because they had given us the brief of how the surgery would go. So we knew for sure that they would stop her heart for a couple of minutes to do the surgery before, reviving the heart again, before the heart would start again. And all I could think of is my child's heart is going to stop today. Like, that's a lot. That's huge. And I could not even help myself. I just started crying. And I was basically wailing because it just could not stop. I was so scared. I was really, really, really scared. And then I think we then gave her to them, and they wheeled her in and closed the door. And we had to basically come out. How did you feel?
Man, it was hard. So first, personally, I did at the time. I did have faith. Well, I still do.
Mm-hmm.
I knew that it would be successful.
Yeah.
I had faith in God. I had faith in the surgeons. So I wasn't scared. But it was a very hard thing to see. It's like I still remember, and I think it was even very hard for me watching you let go. Because you were the last one who carried hand and gave. And I could see how difficult it was, and it really did break me. But generally, like I would say, I was quite, at least for me, throughout the conversations we've had, explaining the surgery, our own research. In fact, it's like we knew exactly what was going to happen because we took time to really study what was going to happen. So I felt like they knew exactly what they were doing. So I was just hopeful that there would be no complications, hopeful that they would not find anything complicated, and it would just be a smooth surgery. But it was definitely a very hard thing to see, like just taking her in and closing the door. In fact, the surgeon, I've been trying to remember his name. I don't know why I can't.
Professor Fotiadis.
Fotiadis, yes, I remember. I really love his name. He came. We met for the first time, so he just greeted, and then he went in. So he went in first, and then I was like, this man he has already gone in, and he's preparing to actually cut my daughter's heart open, and like basically working on the actual heart. So I saw him go in, but of course he had a very good energy. So maybe all of these things just made me a bit more calm. And then the anesthesiologist was also the Uber, right?
Yeah,
also the head. So it was also good. So, but yeah, it was hard.
It was a very hard
day. And then
day.
It's like the moment they took her, we both just stunned, and it's like, what next?
What do we do with our lives now?
What do we do? Because we know that the surgery was going to last for more than 6 hours.
6 to 7 hours.
So we knew that, like, what do we do now? Do we wait just there in the hospital waiting for them to finish? But the doctor had advised, no, that you should just go do something that will take your mind off.
He even said we should go shopping.
Yeah,
and I'm like, who goes shopping when their child is on an operating table?
Yeah, so we just turned, and then it was like, what do we do? What do we do? So I think we had to, they couldn't hold her, some of her stuff, her car seat.
Yeah, so we know we had initially planned that we even went with a blanket that we're going to wait at the hospital. The hospital is quite big, so they have like a park. And we said we're going to wait there and all. And okay, I ate, you were fasting, and you said you were going to fast up until she came out of surgery. Breastfeeding mother, I had to eat. So we said we're going to stay there. But then that morning it got really cold. So we could not be in the open like that because we didn't like carry jackets or anything because we didn't know it was going to get that cold. And then we went to the ward while they, like after they took her, and we went to the ward and tried to give them like her luggage, fill the clothes, because they had told us to come with a lot of clothes, like her stuff, and then the car seats. But then they said they can only take the clothes, but they can't take the car seats, which meant we basically had a car seat with us, and we could not just be hanging around with a car seat. So that was when we decided, okay, that we're going to go home and drop the car seat and come back.
So this is 7:39 and we've dropped her off at the operating room. I think we dropped her off maybe 7:20 or so. So we're basically waiting now to see when we're waiting for the phone call to tell us that they're done. Apart from that, there's nothing we can do except wait, pray, and remain hopeful. So yeah, but when we got home, we just stayed at home. We kept praying. Before we knew it, it was past 12, and then it was like we were now waiting because they said don't expect my call before 12.
Is it almost time? Have they called us? Is there any strange number that's going to call? Because obviously I didn't have the doctor's number, so it was going to be a number that I didn't know. And I just I would look at my time, and then I would lay down on my bed, and then I would pray. That was basically what we were doing until, I think, it wasn't up to 12.
Okay. So, so past 12, we were now actively waiting for the phone call. I can't remember exactly what I was doing when the call finally came in. Because I remember we were in the guest room.
Were we?
Yes. Oh, I was preparing the guest room for my mom.
Okay, yeah, because your mom was supposed to come the next day.
Yeah.
Okay, so your mom was coming the next day, and then, okay, I think I went to the kitchen. No, I was on the phone with Ola. So Ola called while I was crying, like she knew. And okay, I think I first spoke to my mom, or I texted my mom, I don't remember. But then Ola called and I was just crying. So she tried to then distract me, and we're looking for flight tickets. So that was basically the distraction, and we stayed gisting and laughing and looking for flight tickets. Then you then said you were going to go prepare the guest room for your mom, and I was still basically gisting with her. And then I was like, okay, we finished talking, and then I said, let me go to the kitchen so that I make food, because it's sort of almost time, so that by the time they call us, we had food to eat. So I was then in the kitchen when they called, because when they called, I then came to you and told you that I would while they were talking, I then came and put it on speaker. And do you want to say exactly what he said, if you remember?
I don't remember.
So yeah, I remember exactly what he said. So he called and was like, oh yeah, we just finished the surgery, and I'd like to let you know that I'm very happy with your daughter. That was what he said. I found that funny, him saying I'm very happy with your daughter. Was like, a student that he taught she did very well in her exam. So he's like, yeah, I'm very happy with her. So he said, I'm very happy with your daughter, and everything is okay. The surgery went well, and she's now in the ICU, but they are currently handing over to the next doctor, so you can't see her until 4 p.m. So this was around 1 past 1.
2.
That was when he told us this. So he said you can't see her until 4 p.m. because they are trying to hand over to the next doctors. So yeah, and then he said he's going to see us soon. Yeah. So
I thought you did. I don't remember exactly what he said, but I remember the emotion behind, I remember how his voice sounded, and what I could hear was someone who was very exhausted. So I remember when I spoke to him in the morning, I remember how energized he was. But then after the surgery, he was just speaking at it's like when you are tired, they're like, yeah, the surgery went very well. I'm really happy with your daughter. And they're doing so we're going to meet her, speak soon.
Yeah, he sounded tired.
So he was really tired. And to be fair, it does make sense. Imagine you being in a high-pressured environment for
working
hours.
for 6 to 7 hours.
You're basically holding the life of a human in your hands. And as much as they say this surgery is standard and is very simple and standard procedure, it's actually still a huge procedure, because one, the heart is going to stop beating. And they're going to connect to heart-lung machine. So the machine basically keeps this child alive. Two, they are operating on a child that is so small and the heart is probably as big as this hole. Then imagine you trying to go into the heart and then close up a hole and make sure everything you are doing is right, and making sure that every other part of the heart, because it's not just fixing one issue that you have to make sure that there's nothing else that you couldn't see from the scan.
Yeah.
So they do a scan, like a physical scan of the heart to make sure everything is in place, and then they have to be experienced enough that if something is a bit off, they know exactly how to handle it. If not, what would happen is that they do a heart surgery today and then maybe the recovery is not so good or not responding so well, and tomorrow or next tomorrow they go back into the heart and do another surgery. So it is a big deal, and thankfully, like this went well. So the doctor was like, yes, I'm really happy with the result. He explained how it went, he explained what he did, he explained what he found, and he said the heart is good as new.
Yeah, so that was what he said, yeah. And then, of course, so we then like called everybody to let them know that, it had gone well. Thank you for praying for us and all that. And then we ate and got ready and then went to the hospital.
Mm-hmm. So how did you feel the first time seeing your child after a heart surgery?
So before we got to her, we first missed our way. We got there was this nurse and we asked her like, oh, we came to see someone here, and she just took us straight to one black guy, which was funny. I found it funny. Maybe some people find it offensive, but I found it really funny because it looked like that was the only black guy in the ward. But then, like, why did you assume that we came to see him? So it was funny because we got there and we're like, nope, that's not the one.
I don't know him.
That's not the one. And then I said it was a baby that we came to see, and I think she took us to the other part, and then we asked a nurse there, and then they took us to her. How did I feel? To be honest, it was hard, and I don't know. It was worse than the first time that she went into surgery, came out, and she was swollen. We knew she was swollen that time, but for some reason I can still remember that I didn't have the kind of emotions that I have or that I had during the second, like the heart surgery. I walked in, you walked in first, so he got in and washed his hands. Of course, you have to wash your hands and then go in. So I was looking at him because I was behind him, and he washed his hands, went in. Like from where he was standing, I could still see him and he could see her, but I couldn't see her. I couldn't see Elora, he could see her. So I was looking at him for an expression, and there was nothing on his face. Like he was just using the disinfectant in his hand, and he was like this. No expression. So I didn't know what to expect. And I didn't at that moment, it was just like, please, guy, if you're not going to show me something, I need to get in there quickly. So I quickly washed my hands, and then I went in and I saw her, and my heart sank. Like, it was, I don't know, I feel like, I don't want to say it was one of the worst days of my life, but it was terrible because I could not recognize her. She was so swollen. The very moment I saw her, I don't think I even touched her. I just started crying. And I quickly asked the nurse, or was it the doctor? I don't remember if it was the doctor. Yeah, the doctor. I quickly asked the doctor, where's your bathroom? I need to pee. And I think she tried to grab me.
Yeah, when you started crying, she immediately wanted to grab you, and then you said you wanted to pee. And she was confused. She was like, wait, are you crying because of what you saw? Are you crying because you're pressed? So she showed you where the
she then took me to the bathroom. So she left with me while you were with Elora, and while we were going, I then this kind of looked her in the eyes, and I asked her, is she gonna be okay? And I was crying. And she's like, yeah, she's gonna be fine. Is she your first child? I said, yes. She said, I understand, that must be really difficult. And then I went to pee. So I stood in that bathroom after peeing. I looked at myself and I'm like, God, this should be the last time I would ever have to feel this way again, because I was devastated. And well, I peed because I was pressed, honestly. I was pressed, and then I came back, and I think that was when Dr. Fotiadis was there, and he basically started telling us about the different things. I don't know if you remember, they said there were 3 things they ended up doing in the surgery. Do you remember what the 3 things were?
So first and foremost, they closed the hole.
Yeah.
Second was it the PDA?
Yeah, the
that they saw,
binding.
And they put a band.
They called it a clip, like we put a clip on it.
So just hold, stay there. And then the last thing was that they deliberately left a tiny hole.
Yeah.
At the bottom part of the something medical term that connects the left and the right.
Yeah.
But what it does is that because the left ventricle of hers is slightly smaller. So he says that he put in a fail-safe basically. And this fail-safe is that tiny hole that is going to equalize the pressure on both sides.
Yeah.
So it's to make sure that whatever is happening in the heart, there would be no case where the left side is going to collapse.
Yeah.
So, but he says like this hole is even in regular people, like people with normal heart. So sometimes it closes on its own, but it's nothing to be. It has no negative impact. It's just a fail-safe that makes sure that the pressure is not so much on one side.
So that in the long run, like the left part can grow and have like the right size. So yeah. So
but overall, he said this thing multiple times, but he said that he was really happy with the outcome of the surgery. It went really well.
Yeah, so that was basically how the surgery went. And then I think while we were there that same day, they then said, because we asked them like, okay, so since how long is it going to take after the surgery is done in order for her to start eating normally? Because if you remember from the previous video, she was on some type of diet. So how long after the surgery we should start eating without being on a diet and all that? And they said pretty much immediately. So what they then did that same day, right? It was the same day. They then decided to test, to try out some food. As opposed to using like a tube, they decided to give her to suck like from the bottle. Tell them.
So she sucked how many? Once or twice. And then before we knew it, like you imagine when she starts to feed, we're happy, and immediately her heart started to drop. So she stopped breathing. So her oxygen level started to drop, like her oxygen level was dropping, her heart rate was dropping. And I can remember like both of us were just quiet, just looking at them. And they were very close to taking us away. So because it was getting really, really bad.
Really dangerous.
And they were trying, the doctor also calmly trying to say, hey, breathe. They were like shaking her neck.
It's a crazy thing they do. They talk to these babies like they understand them. Like, because I remember the nurse saying, this was not the plan. This was not the plan. You were supposed to eat. This wasn't the plan. Yeah. Breathe.
And then...
So they brought that thing, I don't know, like
oxygen
to help with the oxygen. Like so like a bag mask. And then the mask, and they kept like pumping air into her lungs, pumping. Yeah, you could see her chest to go up and down, and she was just like non-responsive, sort of. She was just there. Yeah. Her eyes were open and everything, right?
No,
her eyes were open because she was really swollen. Yeah, she was swollen, really so her eyes were closed, and just non-responsive, and they just kept doing that. I remember the doctor telling us to move so she could go to the other side of the bed. So there was a nurse on the left and the doctor on the right, and they just kept going until he came back up. And
said, no more food.
Said no more food.
Yeah, so And then the next day they found out that she had what?
No, when he came back, sorry, before then, when he came back up, they then told us to leave the room. We left. They told us to leave. We then went to the coffee room. Do you remember?
Oh, yeah, yeah.
Sit. So they told us to leave the room.
But I think they wanted to put in the oxygen.
Yeah. So they then had to, give her, put like a breathing aid for her. And then after some time, they said they were done and we came back. And they now told us, the nurse, I really appreciate her because she couldn't really speak English. So and you could tell that she was trying to be as positive as possible. She then told us that it would be nice for you to go home. Today has been a long day, and by tomorrow she will be better and you could carry her in your arms. So go home and sleep so you can have enough energy to carry her. That was what she said. When you look back at it now, you know very well that she just wanted us to go home and rest after such a stressful thing that we had just seen. Not necessarily because we needed any energy for whatever. It was just her way of politely saying, go home. You don't see Shege today. So yeah, that was pretty much it.
Yeah. So the next day we came to the hospital and we ended how on the day of the surgery we saw her swollen and you broke down. The next day was now worse. Like when I got to the hospital, I was like, why is it getting worse? She was even more swollen on this second day. And then we had to ask, why is this normal? Why is this happening? And they had to explain that yes, the body has gone through a lot of trauma, and now the body has to start draining all of the liquid that they even had to put in for the surgery. So ideally, the body is going to drain this by the child peeing. But now she wasn't peeing. So they had they saw some issues with, was it an issue or whatever, but the kidney just refused to work. And they explained it it's like when someone has a job to do and they have not so much work, or they have their regular job, they do their job. But then if you bombard them with so much work, they can just say, no, it's too much, I can't do anything. And then they stop. And this was the case
with the kidney.
This was what was happening for her. The kidney just refused to process, to work, to
the guy
pass.
was chilling.
So they were just trying different stuff, trying different medication, trying different things to what they said was, they want to do certain things, like give certain medications so that the medication can help the kidney. Then the kidney would see that the work is reducing and then start to do its job. So they were just trying different things. They said that when the kidney starts to do its job, you would see a drastic change. So the moment it starts to work, then you would just see a lot of liquid leave her body and you would see her actually get back to herself. But this didn't happen for days, right? It was days because they were constantly measuring to see how much pee has she passed. Is this too little that we need to do something? Is this an emergency? Is this something that we can watch? Because she had tubes in, she had different tubes in her body. Some were connected to the region of the surgery. Some were connected to her bladder. So everything was just going. So yeah, for days this didn't change. So they were trying different stuff. They saw the bubble. This one was where? This time was in the liver.
It was in the liver.
Yeah. So they saw this. They say it does happen, but it doesn't really happen. It's quite rare. But maybe it happened to her because she had already undergone a surgery in her stomach. So maybe it increased her chances of having this. So they gave her antibiotics and they also monitored. And during this period, they couldn't give her any kind of food through whether through the mouth or through the tube. It was just no food.
Yeah,
right?
so she had to, through intravenous, so
Yeah.
they had to give her lipids and, what's it called? I forgot the name of the other one, but yeah, two things. One was basically fat and the other one was nutrients through the vein.
Yeah. So, good news is the antibiotics did work. I think it worked after one day because they said the next day that it had gone, right?
Yeah.
Yeah, but still, they didn't give her the liquid because they wanted to just make sure that certain other, like she doesn't react that way again. So this time they were still monitoring the pee. It still wasn't as much as it should be. But I can't remember the exact day. Do you remember
The
when
what?
there was a
Drastic
change?
change. I think it was the fourth day. I think it was the fourth day because that day you went to the office and then I went there. And as at the morning, I could see that she was still a
Yeah.
bit swollen. But then by evening, that was when they moved her from ICU to recovery ward. And I didn't even notice the difference until I sent you the video. So I sent him a video of morning, how she looked in the morning, and I was there with her the entire time till evening. And then they took us to the recovery ward, and then I made a video of her and then I sent it. And I think I didn't even realize while I was there until I came back home and we looked at the video and was like, oh my god, like she's back to herself.
Yeah. So it was huge.
Yeah.
And in just how many hours?
Yeah.
So that was good. So the P was good. She had reduced. Now the next thing was, or the next milestone was that the tubes that were running from her
Hats.
her heart region, like basically draining the blood, those had to become clear, and then it had to stop.
Yeah.
So in the ICU, it was bloody. So it wasn't so much blood, but it was really red. And what they said was that had to turn clear, and then it had to stop, or at least the amount of fluid that would be in the tube would be so small that the body can absorb. In that case, they can remove the tube and then close up the site.
Yeah.
So we're basically waiting there. I can't remember exactly how many days, but from what I saw, also looking at the other patients that were in the room, hers was actually really good.
Yeah.
Because someone who had the surgery before her still had the tube in after hers was removed.
Even up until the day we
Even
left
till we
the
left.
hospital,
Yeah,
the
so-
child still had the pipe or whatever connected because she was still draining.
So her healing was really good, and we're really grateful about this. So after, like, while all of these things were happening, she had so many medications. She had even what's this sleeping one?
Morphine.
Okay, she had morphine as well for the
Yeah.
pain.
Yeah, there was a
And-
point where she was in like at that beginning phase where she was in so much pain that there was a time, I don't know if you remember, there was a time when I went there that morning. I don't remember if you went with me, and then they told me that they had to give her, basically sedate her, because she woke up and she was very, very agitated and was crying and fighting and pulling. So they basically had to sedate her. So yeah, so for a while she was on like morphine, and then they slowly reduced it and then started giving her paracetamol. So
Yeah, and the goal for them was to slowly stop all of the medication, and instead the ones that are needed become oral, so no longer through the IV. And if you remember earlier in the video, we mentioned that they put in one catheter, but then when she came out of the surgery, she had one more on her neck. So this one on her neck had like
had a lot.
so many lines,
There's
basically.
so many
but
lines.
No, I think it was 3.
There are three
Three
major
lines,
ones
three,
connected to many more.
Yeah, exactly. So
Yeah.
it's like, I think we definitely have pictures, but you'd see so many stuff connected to it and different drugs going in. There's one water has to go in to make sure that the blood doesn't clot, so that, because if it does, then the entire region is gone, and they have to look for another one and put another one in.
Yeah.
If not, they won't be able to pass in all of the medication that she needs at the time.
Yeah,
But-
apparently that part is the central vein or
Central,
something,
yeah.
like a vein that goes that's connected to the heart. So that was why they had to put that one there for like it to get everywhere. So yeah.
So there were even cases, we had certain incidents with this catheter that was actually quite scary, because there was a time where one of them just got blocked, and then we could see a
Air
pocket
bubble.
of air just staying there. And of course, you know how dangerous it is for air to go into your vein. So like there was a time when things were just happening and it felt really chaotic. Why is this happening? And it's not like they did things right, but we just didn't know why this happened. But luckily, like everyone was, they were proactive. They were able to catch all of these things quickly, and then everything was just back to normal.
Yeah.
So I still remember the first time that they gave her, when the first time they gave her medication via the mouth,
Yeah.
because for some reason she completely forgot how to suck. So she couldn't, like, if you try to put, maybe it was because she was swollen, maybe, but when you put anything in her mouth, she's just like, she doesn't know
What to do with
like,
it.
but then when she finally sucked, we were so happy. And then finally they said, okay, let's try to introduce milk, little portions at a time. And then they allowed us to feed her maybe about 5 ml of milk, something really small. And then when she sucked it, she finished it, we were so happy. Like looking at your child learning to eat again after a very long time.
Yeah.
And then they gradually bumped and bumped.
And for what is what, a very long time was a week, about a week
actually.
or even 5 days,
Yeah.
but it just felt like a long time
Yeah.
because she
And
was.
she had not even eaten. Because remember, she didn't eat before the surgery. She didn't eat on the day of the surgery. I can't remember if she ate the next day, but she was really starving.
Yeah,
She was really starving.
starving in the sense that like
Before the
there was
surgery,
nothing in her stomach, but then they were giving her the nutrients and everything through the vein, but
before the
the
surgery,
stomach
they
was
didn't
empty.
give her anything.
Yeah, they didn't give her
Yeah,
anything.
so-
That was the first meal they gave her, the one where she now sort of stopped
exactly.
responding. Yeah.
So she was hungry. She was tired, and she was, like, I still remember when she opened her eyes, like she was, so it was swollen, and then just a little, just saw her eyes, man. But thankfully, like, all of these things happened, and her recovery was really good. There was no infection whatsoever, which I would say was better than the last surgery, the one in the stomach, where she had the huge infection.
Yeah.
That even, I don't know if it was the infection, but then she also had the methemoglobin. You can see in the last video all of the complications.
Yeah.
But for this one, it was very straightforward. In fact, the healing felt so easy that I wondered if this was a harder surgery to perform or a more complicated. I don't know.
It was too easy that I also did not believe that this was like an open heart surgery, because everything just felt like, oh, okay, just that.
Yeah.
Because they said like we should expect her to stay in the hospital for 10 to 14 days, but as at day 9 we were discharged, or I think day 8 we were already discharged, which was amazing. Like we were so happy. I still remember when I went to the hospital to get her, like we were really happy. And then she came home, they gave us like extra plasters, like, oh, you can change her plaster by yourself. I'm like, what? Who? Me? Why? You know. But in the end, I did it. At first I was scared, I wouldn't lie, but we ended up changing her plasters by ourselves. Like I think every 2 days we're changing the plasters, and then they gave us some rules. So do you want to say the rules that we had to adhere to when she came back home after the surgery?
So for one, don't lift her up from her armpit. So don't raise her like this. And then as much as possible, don't even keep her straight, at least at the time.
Yeah.
So she would lay flat. And then if you want to feed her, you just feed her, keep her around that. You can put her a little bit to the left, put it to the right. But definitely not on the chest. So no tummy time. What else did they say? No, you don't shower her, so you don't want water going to the region of the surgery.
So she didn't shower for like 6 weeks. Damn, she didn't shower for like 6 weeks.
Yeah. What else did they say? Her medication, of course, she shouldn't miss her medication. So we had to even start ordering stuff. Whenever.
Her medication was changed.
Yeah.
So though we had like a lot of the previous ones, we then had to basically, I think we gave that to the hospital or like donated it to them, and then we got new medication that she had to be on, because well, the old one was no longer valid for her, and then she had to be on the new medication. And then I think we had to see her doctor immediately after we came back home, and the hospital already called her doctor, like her private doctor, to say, hey, like, we are discharging this patient, you have to see her pretty much soon. So I think 2 days after or something, I don't remember, we went to her doctor checked her and everything, and then told us to go home, and then came back. The next appointment was like the 6-week checkup. And yeah, so pretty much 6 weeks later, we went to her doctor. They checked her, and then they decided to do like a 24-hour ECG, in German EKG.
But even before then, do you remember like when we went for the first checkup with her cardiologist?
Yeah.
He could see the difference.
Yeah.
Like he was also really happy. It's like even we that are not professionals,
medical
we
professionals,
could see the difference in her heart.
Yeah,
the
in the way
before
it
and the
looked,
after.
the beats and everything.
It was the change was huge. So this like I could now understand why and how they were able to see the difference in the heart, because before when they see it, I'm like, but this looks the same to me.
This looks.
You're telling me that there's a hole here, but there's a hole everywhere. So yeah, but he was really happy about the result, and he was like, no, this is beautiful. So
yeah.
So they did the EKG.
Yeah, so ECG, I know EKG. So basically, he did the ECG for 24 hours. So she had to be connected to a small like machine for 24 hours, and then they read it and checked and saw that everything was okay. The heart reading was good, everything, and then they stopped like 2 of her medications, which then left her with just 1, and it was simply because not necessarily like she needs it per se, but because you don't just stop everything at once, because the heart will go into shock. So it was more like, okay, we stop this 2 because we can see she's doing really great, and then just let her be on this last one for some time, and then we'll stop that one, so that it's not a drastic change, automatically. So that was pretty much what the report was. And then I would pretty much say that her scar has healed, so she's no longer on any plasters. She doesn't have any plaster or anything. She has showered a lot. I was so happy when they finally said, you can shower her now. I was so happy. Her scar looks really good, and she can sit up now. She can do tummy time now. She was not doing it for a long time, so it felt like starting all over again, but that's fine. So she's doing tummy time now. I would say she kind of likes it. Sometimes she doesn't, but she likes it sometimes, and she falls asleep. So everything has been going great since then. One of my major takeaways from this entire experience was the fact that, or more like after the experience, I would say, it felt like everything had been fixed, right? There were too many things I thought. I could be wrong. Maybe I didn't see them. It was just in my head. But there were too many things I felt were wrong. But the very moment that she had surgery, it just felt like everything started falling into place with her. And all I kept saying is, God fixed her. God fixed her. He didn't just heal her heart. He didn't just go into the surgery room and direct the surgeons on what to do. He fixed every aspect of her life and every area. And to be honest, it felt like a burden had been lifted off of us. Yeah. Like we didn't have that whole, okay, there's a heart surgery coming up, hovering over our heads anymore. It was like, okay, this is done. We can now move on with our lives. We can do stuff. Like we're even planning on registering her for swimming classes. Like it felt like we could move on with our lives. Things were going on well with her. I was no longer scared, like with her. Like before, I was always basically putting my ears to hear, how is she breathing? Is she breathing right? Is this supposed to be so? Now when she plays and she's like panting heavily, I'm not even worried, because I'm like, yep, that's normal. You're okay. You get to. I felt really, really relieved. And to be honest with you, a lot of people will say, you're in a developed country and you have all these resources. It's not God. You had the resources. Like, how else can somebody explain to you that a heart was stopped? It was opened, like they opened you up, stopped your heart, brought it out, did whatever they had to do, put the heart back inside, and that heart started functioning so perfectly. It's not, that doesn't make sense for science. It's not 100% science if you ask me. God's hand is in it, and it was such a huge, I would say, testimony for our family, because we can now understand certain things that we didn't understand before. We are closer to God than ever before. We understand God better. We see the things that He does. And when they say they are marvelous in His sight, they are marvelous, because it's amazing the kind of things that He can do. Sometimes I look at her and I'm like, if it was an adult that went through the things that you went through, like, you would see it, it would show. But look at a child that has gone through all this, and she's such a happy baby. She's just playing. I don't think she even knows what she has gone through. She's thriving. She's doing so well. And there's like so much more that God is going to do in her life. And it just makes me so grateful. Sometimes I sit down and I'm like, thank you, Lord, for choosing us to go on this journey with you, to be able to share our story and our testimony to other people so that they would know that you are real. And that for me is like the best part of everything, honestly. So I really thought I was going to cry in this video, but I'm so happy that I'm so strong. And yeah, we would stop this video here. It's already too long, but I think this is the part where we are going to share with you something that's very important. Do you want to?
Yeah, you go ahead.
Okay. Saying that we've gone through this experience, God has put it in our hearts to assist someone out there that is going through this experience. So my family and I, we have come together to decide that we would want to help a child out there who has, a heart condition, VSD. We, especially in like the African region, Nigeria, we are looking to support this child's surgery. And in order for us to do that, we want you to help us as well. So if you're seeing this video, please help and share this to people who probably has this, or know somebody that knows somebody that has this. And we're putting our email in the description box below. Send us like your medical record and stuff. Let us know what it is that is happening with this baby, and we want to assist with this baby's surgery. We want this baby to have a second chance at life like our daughter has had. And the way I see it, our daughter has a new heart, and she's going to be able to to live life and do well. And we want a child out there to also have this opportunity. So if you know someone, please share to them and send our email to them. They should reach out to us. And we pray that as we go on this journey with God and in finding that person, we pray that God is going to also touch you, because we know that it is not by our power that we are doing this. We are just simply listening to God. And we pray that this is worthwhile for you and your family, and we pray that your child will go on to live an amazing life and thrive as well, in Jesus' name. Amen. I think we can say we've come to the end of this video. And any last words? Bye.